What do you think are important aspects of practice management in our current healthcare system? Just a really light question for you.
Of practice management. I mean, I guess when I think of management, I go to KPIs, and really just because what's monitored gets managed. So it really just depends on what your KPIs or your key performance indicators are. So if you think about a balanced dashboard, I think, unfortunately, not a lot of people have exposure or are in the environment to have conversations surrounding a balanced dashboard. So I think a lot of times they just hear productivity. So it's just, how busy are you? How did you bill? I would say that that's valuable. And I would argue that people still need to understand the importance of metrics that are tied to revenue, which should ideally be tied to things like salary and profitability and reinvestment and growth. People just need to understand how finances work. And that's something I think sometimes, even if you just look at any profession, the baseline level of financial literacy surrounding like personal finance and business finance really just isn't there.
Right.
And then I would take that, so that I kind of break it into thirds. So you've got those metrics, which are, I'd say, they're objective, it's just a reality, but I would say this is more of a byproduct metric. Those are more byproduct metrics. It's like, all right, I've got people in the door already, and these are how many people are in the door each week, and these are how I'm billing the people that are in the door. So that's, your byproduct metrics. And then to really, really gauge whether or not things are going well, you could view these in different buckets. You have your outcome measures. So outcome measures are somebody's, their subjective reporting. So you could look at LEFS, you could look at any of your Westries, right? Your Quick Dash. You could look at pain level reporting at initial, progress, and at the end. You could look at the level of satisfaction, and you could look at whether or not they're communicating if their goals are met. So those are their feedback that is more related to their level of improvement or their gauge in terms of whether or not they are progressing. When I think of satisfaction, right, you think of goals met, you think of Westry, and you think of pain. Those are four metrics in which they're kind of going through and trying to figure out whether or not they're actually improving during a course of care. And then two things that I would say would be in another third. These are more associated with brand loyalty, word of mouth marketing, whether or not somebody's going to refer people to you, whether or not people find that or connectivity to whatever it is that you're providing them. Those would be net promoter score and churn rate. Net promoter score is this kind of gold standard associated with brand loyalty, customer appreciation, and whether or not they feel like they're in the right place, so to speak. So that's on a 1 to 10 scale. Obviously, there's an objective metric, but I still say it's like you're putting objectivity to something that they feel. So there's a subjective component to it. And then churn rate, I would say that somebody is going to churn out of a service if they don't feel like they've been listened to, they don't feel like there's high value with what's going on, the environment's not clean, they don't like how they were spoken to. So right. Their overall perception of the experience, they're going to keep coming and experiencing it if there's a certain amount of value there. If they churn out early, then they're not. So that's kind of how I view a balanced dashboard. If we're monitoring those different things based on, things that are going to pop up, events, situations, this, that, and the other, or some of the metrics that you get back, ideally that triggers certain actions. So yep. You're monitoring them to manage them. I hate using the word manage, but
I know.
Nonetheless, it's still something where, ideally you're providing productive conversations. And I would always say that instead of management, a company should be self-reflective and figure out whether or not the messaging and what's being communicated, or this person's been trained properly. Like, you have to refine something there. The guardrails don't fit. So I've got to figure out, am I in the right guardrails? Are the guardrails too loose? And what do I need to do moving forward? It's not always a people issue, but that, yeah,